We have a very special show for you tonight with endocrinologist Dr. Akshay Jain, who's going to be talking about what happens in our bodies when we lose weight, why weight regain happens, and what we can do about it. It's going to be a fantastic show, but before we get started, tell me in the comments where you're watching from, and be sure to tell us if it's your first time watching. Dr. Jain, thanks so much for being here with us tonight.
Pleasure's all mine. Thanks for having me.
I'd like to start with a phenomenon that I think everyone who's tried to lose weight knows so well. I change something, like I start eating differently, or I go on a diet, I try to exercise plan, and I lose weight at first, but then eventually I gain that weight back. Why does this happen? Why do studies show that 90+% of people who lose weight gain it back?
You hit the nail on the head there, Ansley. That's probably the most frustrating part of working towards weight loss is that regain that tends to happen. And the answer lies in the way our body has the brain has been hardwired. So what tends to happen is that when we start losing weight, our caveman part of the brain, even though we are trying to lose weight intentionally, it feels that we are getting short on nutrition and resources. So it starts to ramp up our defense mechanism. So what tends to happen, and I often tell this to my patients as well, there is a thermostat in our brain that regulates the weight. And this is kind of like a rubber band, right? So if you have a rubber band and if you start losing weight, it's the analogy is that you're stretching out the rubber band. So the more weight you lose, the more stretching you're doing for that rubber band. But inherently, that tension that's created in the rubber band is such that the body always wants to go back to the baseline. So there will be times when, if we lose that focus, then the rubber band gets snapped back. And that's what tends to happen. It's that thermostat which has automatically kept our weight at a certain point. When we start losing weight, it just wants to go back to the baseline.
So, Dr. Jain, you're an endocrinologist. Let's talk about the hormones that regulate weight and how our bodies react hormonally to weight loss.
We tend to have two different kinds of hormones when it comes to the weight regulation. There is what we call anorexogenic hormones and then the orexogenic hormones. So, anorexogenic hormones, derived from the Latin root anorexia, are the hormones that help our body to reduce weight. On the other end of the spectrum is the orexogenic hormones, and these are again from that caveman part of the brain where it says that you've gone too long without eating, your body's falling low on that nutrition resources, so you better start, hitting the fridge there and start eating. So it's a fine balance between these anorexogenic hormones and the orexogenic hormones that help to regulate weight on a day-to-day basis. And then, if you zoom out a little, you'll notice that there's other hormones that also play a role. So these could be sex hormones like testosterone in men, estrogen in women, stress hormones, especially cortisol. And these hormones can often regulate our body's weight in an indirect manner. And this is more of a broad based weight regulation compared to the orexogenic and the anorexogenic hormones that are more of a fine tuned day to day weight adjustment.
So, when we lose weight, do our hormones change in a way to make us hungrier? I know a lot of people say, like, I'm losing weight and I'm hungry all the time. Is that our body trying to protect us?
Absolutely. So that's when the body starts, really ramping on the brakes with wanting to make sure that we don't lose too much weight, even though we are trying to lose that weight intentionally. So what tends to happen, going to the rubber band, so essentially when we start losing weight, we are pulling that rubber band, and it takes a lot of effort to keep the rubber band stretched. However, what tends to happen is the body then realizes that you're losing too much weight. So it cuts down the anorexogenic hormones, the hormones that lead to satiety and feeling that you're full. And it ramps up the orexogenic hormones, which are the ones that lead to more craving. So essentially, what happens is the more you stretch this rubber band, the more the orexogenic hormones start going up. And then there's this paradoxical intense craving for foods or for increasing our nutritional intake. At the same time, what tends to happen is that on a day to day basis, we are losing calories just by regular things like breathing, sitting, walking, just day-to-day activities. And this is essentially what regulates our metabolic rate. So when we start losing weight, the caveman part of the brain says, all right, we got to stop this. So it reduces that metabolic rate. So we tend to expend fewer calories. So on one hand, the body's going to cut down the caloric expenditure. On the other hand, it's going to ramp up the craving. And that's why, the body's working against your efforts to lose that weight.
We're going to take a break to do our trivia question. If you answer tonight's question, folks, you will get some delicious ideas for budget-friendly meals. Going to the grocery store is more expensive than ever, and our dietitian has come up with some great recipes for healthy meals that are affordable too. You'll get those recipes for free if you answer tonight's trivia question, which is, true or false, spending time outdoors can improve your mood? Can spending time outside improve your mood? Put your best guess in the comments, and regardless of whether you're right or not, you will get those tips delivered to your Facebook Messenger inbox. So Dr. Jain, you have a wonderful YouTube channel where you make awesome short videos, and we will put the link to your channel in the comments so folks can check it out. One of my favorite videos you've done is about dealing with cravings. So I have to ask you, can you share with our audience tonight your best tips for dealing with cravings?
So often with working with my patients, we try to devise ways where we can fool that caveman brain, right? And try to make sure that we don't fall in to these cravings, even though it's completely natural to have the cravings. So what I tell my patients is about the 5 Ds of resisting cravings. So the 5 Ds include delay. So oftentimes, if you're having this intense craving to eat something, make a trade with your brain. You tell it, okay, I'll have that thing that I'm thinking about eating, but I'll have it after an hour. So I give a set time. And then when that hour rolls in, if I'm still having the craving, then I'll say, maybe I'll have it after half an hour. So delay is the first D. The second D is distract. So oftentimes, like I said, when I'm at work, we may often start thinking so much about work that I don't think about my orexigenic hormones. But if I start distracting myself, maybe go out for a walk, spend time with the family, then I don't think too much about the craving. So the second D is distract. The third D is drink. So, what tends to happen is when the stomach starts expanding, that's when these triggers get sent to the brain saying that, hey, we've got something in the stomach and it reduces the craving. Now, so far, we've got delay, we've got distract, we've got drink. The fourth D is distance. Now, oftentimes there is one particular part of the house or your office where there is, foods that are readily available. So, say for instance, that's the refrigerator or the kitchen in your home, or the pantry or the lunchroom in your office. Just try to step as far away from that area as possible, because the body loves to have what I call mindless eating. So if you're walking by the refrigerator, or if there was a bowl of candy, you unknowingly just pick up one and have that candy. So try to distance yourself away from areas where food is readily accessible, because particularly during the times of craving, that's when the hunger hormones can really make you make decisions that are not really ideal. And then the fifth D is decide. So essentially, decide means always introspect and look at what has been working so far and what has not. A lot of times we may have hunger cravings associated with certain stimuli. So, for instance, if I've had a stressful day at work, I come back home and I feel that I deserve to have that tub of ice cream because work was so bad. Or when I'm, binging on my favorite Netflix show, I may have some mindless eating where I may have a popcorn or something else that I'm mindlessly eating. So try to see what happens and what these associated stimuli are, and then try to break that stimulus so that we distance ourselves from these cues. Try to see what's working with the cravings, what's not, and reinforce the things that are working. So, just to recap, 5 Ds: we do delay, we do distract, drink, distance, and then decide.
Oh, I love the 5 Ds. Lots of women report gaining weight during menopause. Tell us, why does that happen, and is there anything we can do about it?
So this is a very common observation, and it is multifactorial. So one of the main things that happens during menopause in women is that the estrogen production goes down significantly. So the ovaries are no longer able to produce estrogen. And when estrogen levels go down, if people or if women have weight gain, then that weight gain is essentially in the belly region and not as much in the hips or thighs. So, lack of estrogen leads to redistribution of the place where we have weight gain. So, it's generally in the belly region. Also, what's happening at that same time, so menopause may sometimes be quite a difficult time for women, so it may be stressful time given the symptoms that may be occurring. Sleep can often be affected, and when we are not well rested at that time, our hormone levels, the stress hormone levels, can go up. When we are not well rested, we have an increased predilection of gaining weight, so that's another factor. Also, menopause is occurring, say, in the late 40s or 50s. So, as we're growing older, at that time, our body tends to lose muscle mass. And when you're losing muscle, you preferentially gain fat or adipose tissue. So essentially, what tends to happen is the nutritional intake that we have then starts getting redistributed to develop more fat tissue in the body. And that also contributes to obesity. And part of it could also be genetics as well. So, multiple factors that unfortunately uh, can explain some of the aspects of weight gain during menopause.
So, in case you're just joining us, we're here with endocrinologist Dr. Akshay Jain talking about what happens in our body when we lose weight, what causes weight regain, and what we can do about it. And we're sharing some delicious ideas and recipes for budget friendly meals if you answer tonight's trivia question, which is true or false, spending time outdoors can improve your mood. Is that true or false? Can spending time outside improve your mood? Put your best guess in the comments and you will get those recipes delivered to your Facebook Messenger inbox. And folks, Dr. Jane is sharing such great information with us tonight. If you can think of any friends or family members who might find this show helpful, feel free to tag them in the comments so they can tune in with us. So I know a lot of people think, I know what I need to do, I just need to do it. Is there a specific point on our journey with weight when it makes sense to say, okay, I'm going to talk to my doctor about it?
I would say the sooner the better. So we often tend to go to Google where we have a generalized approach. And as you mentioned, Ansley, if something works for my friend or my neighbor, then I'll be more likely to try it. Unfortunately, the dialogue or the communication may often be closed with your healthcare providers. Studies show that most people living with obesity are suffering from obesity for almost a decade, 10 years, before they bring it up with their healthcare provider. And sometimes healthcare providers are a little hesitant to bring up that topic of weight as well. So I think we really need to open our channels of communication, talk to your healthcare provider, and see if how you can best address the weight problem. And the sooner you do it, the better it is, because if we live for a long time with obesity, then that thermostat in the brain for our weight gets set. So we want to make sure that we are able to address this at the earliest possible time. Also, the earlier we address obesity, the less likely many of these complications like sugar problems, blood pressure, so on and so forth, will not have a time to flare up. So the sooner we do this, the better.
So, you mentioned earlier all the different ways our weight can impact our health. Can our weight impact our heart health, like our risk for a heart attack or stroke?
Definitely. Weight is one of the biggest risk factors for increasing the risk of heart attacks, strokes, heart failure, a bunch of these things. So we do know that when we have an increased body weight, there's a lot of inflammation going on in our body. And it is this inflammation that can often cause the arteries in the blood vessels in the heart to kind of block up, clog up, and that can lead to increased risk of heart attacks and strokes. And then also with the increased weight, there's more strain on our heart to keep pumping, and that can often affect the ability of the heart to pump. So there's that risk of heart failure. Coming closer to today's day and age, we did see, unfortunately, that when someone gets affected with COVID, for instance, if they also have obesity, then the risk of heart complications are much higher, essentially because of that inflammation.
So, for the men watching tonight, Dr. Jain, is there anything specific you think they should know about reaching a healthier weight?
I think obesity in men is often not spoken about at all. Part of it is, unfortunately, our society places a lot of undue emphasis on how women should look, and just the way social media is there, or the peer pressure. A lot of women are often under undue amount of stress. They are expected to look a certain way. To the other side of the spectrum, men may not have that same degree of social pressure, but that does mean then they are less likely to discuss about this with their physicians. And as a result, these complications of diabetes or of obesity could often brew. And that by the time these complications get so bad, a lot of things that could have been reversed or corrected at an earlier stage with the obesity, we now miss that window of opportunity. Men too tend to have a lot of obesity related complications. So, apart from the regular ones that I spoke about, which is the sugar, the blood pressure, the cholesterol, sleep apnea, arthritis, men with obesity may often have low testosterone levels, and that in turn can affect the man's sexual health, the muscle structure of a man, as well as their heart health. So that's one of the other reasons why men suffering from obesity should seek help. The sooner the better.
Okay, last question for you that I've been asking all of our guests recently. What is the number one thing you wish people knew about weight loss?
Oh, I'm so glad you asked me this. And I'm going to speak from my practice with every discussion I've ever had with a patient. When you are losing weight, there will be a point of time when you will hit a plateau because you've stretched that rubber band out as much as possible. When you're not losing any more weight, it doesn't mean that you're failing in your efforts. So do not get discouraged. In fact, the ability of maintaining that weight, keeping that rubber band stretched, also indicates how much effort that you're putting in. So do not lose hope, do not get discouraged, because if at that point of time, if you stop doing what you're doing, then that rubber band is going to snap right back, and then there's going to be weight regain that leads to a lot of frustration. So bear in mind the increased cravings that you're having, inability to lose any further weight. It's all part of your body's physiology or normal functioning, and it's completely normal.
Dr. Jain, thank you so much for joining us on the show tonight. This has been such a great conversation.
Thank you for having me.
And a big thank you to everyone watching at home. We really appreciate you being here with us. Before we go, here's the answer to tonight's trivia question. True or false, spending time outdoors can improve your mood? The answer is true. It's certainly true for me. All the more reason to get a little exercise outside when you can. If you didn't get to answer the trivia question, but you'd still like those ideas for budget-friendly meals, just leave a comment for us and tell us what you thought of tonight's show. Please stay safe and take good care. Good night.